Hello, happy Wednesday. I am here cooking in Southern California. It's a pretty hot day and I'm excited to join you all live for a little bit to talk about what we have been learning and doing here at Reactive. And I have been very lucky to be a part of an awesome group led by Indu Subramanian. She's a movement disorder specialist here in Los Angeles at UCLA. And she does a lot in the realm of wellness, exercise, mental health, in neurologic disorders, and in particular in movement disorders. And she asked me to put together a talk, two different talks actually, for a wellness page that she's put together. One talk was for healthcare providers and one was for people with Parkinson's, and on the mental health benefits of exercise. So this was maybe a month ago. I put together these talks, went through a ton of literature, and I wanted to share a little bit of it with you. And in particular, I know for myself, and when I talk to the therapists that I'm working with at Reactive and our therapists that are in our Brain Bites group, one of the things that can be so challenging to implementing all of the changes that we might help people develop to help recover in their neurologic disorder are things like depression and anxiety, apathy. These things can really get in the way of somebody's ability to put something into action. And it makes sense why that is difficult. And so we may all know, and the literature shows the benefits of exercise. And in fact, the post that I did today went through all this literature for the mental health benefits of yoga. And this is in Parkinson's, by the way. We would have like 20 slides if it was all over the place, but for just in Parkinson's, mental health benefits of yoga, aerobic exercise, dance, one of my favorites, and goal-based exercise, we can see that regular participation in these actually change people's depression and anxiety and apathy, improve their motivation, improve their social interaction, all those amazing things. We know that it can be beneficial, especially when done regularly. So in all of these studies, they were at least 8 to 10 weeks, at least once a week of regular exercise to see that change. We know it's beneficial. And that doesn't always help us because people need to get started somewhere, right? And that can be the hardest part, is how to get started when a person is already experiencing a lot of depression or already experiencing a lot of anxiety or apathy, whether that is related directly to their neurologic disorder, like it is in Parkinson's disease, or as a secondary piece. It doesn't really matter. It can get in the way. It can be a barrier to implementing things. So this is where I think more than just knowing that these things help, it's how do we as therapists help people to get started in these processes. And I had the great fortune, by the way, to work with one of our amazing therapists, Ari. And Ari is our movement disorders fellow. She's finishing up the fellowship in the next 4 months or so and really doing an amazing job. And she and I have worked really closely with some of the people that she works with on this thing, getting started in an exercise program. She did a phenomenal job with this, by the way, just today. So I wanted to talk about how we might help people get started, and even what does the literature say. And one of my friends, colleagues, mentors is Lori Quinn. She is at Columbia University, amazing researcher and neuro PT there. And we have collaborated with her on some research studies, in particular in Huntington's disease. And she has she's published a lot in this area. One of the areas for us as therapists to really consider is understanding the person and starting with that piece. So that formal name of that is self-determination theory, which really just means start with the person versus just prescribing. And I think when I was in PT school and early on, that's kind of what I was taught, was to actually prescribe something to people, like, you will do this many reps, this many times, right? And that was like kind of what I thought was the way. Well, what we have found in the literature is that can be helpful for some people, but for most people, it is better to start with the person where they're at. This is where we bring in all of the optimal theory, so providing autonomy and choice. And with this, so start with the person versus prescribing. So that is the first piece of really implementing self-determination into taking that step for exercise for mental health. Second is provide autonomy and choice. And third is provide some mastery of it and small success. So I want to give you a quick example, even from what Ari and I chatted about today. A lot of people, when they want to take on or they think of an exercise program, they're like, okay, I need to meet the guidelines, right? The CDC guidelines for exercise. I need 150 minutes a week. And if I don't do that, I got nothing. And so they're setting the bar here. That's really hard to achieve if you're going from nothing to 150 minutes and you don't feel that sense of success. So starting small with, like, can we get 5 minutes? Can we get 20 minutes? Can we maybe get 30? Can we do 1 day a week? Can we do 2? And more specific, what are some of the barriers that might get in the way of doing that? And if a person has had anxiety and depression and apathy, that alone can be a barrier. I mean, it's hard to get out of bed sometimes with those heavy feelings. So recognizing that barrier right away and talking about strategies to overcome that. So some people, like myself, need, a personal trainer. I am working with the amazing Kaylee Zapanta. You can find her at Fit with Kay, and she is great. And I knew that for me, I needed that accountability to be able to have a regular exercise program. I am going to point out too, because Brian is joining this live, and he said, I can't stress how important exercising has been to help with my flare. And Brian, thank you so much for sharing that, because that's another thing that we'll often bring into the mix, is sharing other people's success stories. Brian had a flare of symptoms, and what did he do? He started exercising and exercising regularly, and that regular exercise has been part of him regulating his nervous system and improving his symptoms in a flare. And so this is something that I can share with other people. Like, I've seen people like this. I've seen people in your shoes, and other people have overcome this. And, Brian, you should share your story. Share what you've done, right? Like, he's got a schedule. He's got a regimen. He's back to the gym, all of those great things, which is awesome. So that is another piece of incorporating the optimal into really coaching somebody into an exercise program for mental health, is those enhanced expectancies. We've got to share the stories of other people who have overcome some of the barriers, overcome some of the limitations, and been able to implement, and how they did it. And it will be different for every person. Not everybody needs an amazing personal trainer like I have. I know I'm talking a lot about her, but she's so awesome. And I've never had a personal trainer before, and I'm so stoked. I don't know if you can see behind me, I got all my weights over here. So she's got lifting weights. I'm doing all these things that I never thought I would like doing, and I and really like them. So everybody's going to have a little different, but explore those barriers, establish ways to overcome barriers, and set up for small success and mastery. So start with, this is a conversation I like to have, is what is one thing that you feel at least 80% confident that you could accomplish next week? Or we may start the reverse. If somebody says, well, I think I can do a workout on the bike, workout on my spin bike 3 days out of the week next week. And then I'll ask, okay, how confident are you that you can implement that next week? And if they tell me 50% confidence, it's very unlikely that it will happen. Like, we need to get to something that you feel 80% confident is going to happen. So let's revisit that goal. What about 2 days a week? Or what about 1 day a week? And if they're going 1 day and they're like, I'm 90% confident, I'm feeling pretty confident as well that they're going to achieve that goal. So we do a lot of back and forth because we want to have that small success and mastery first. And especially if somebody has a neurologic disorder, especially if they have a neurologic disorder like Parkinson's that directly affects motivation and causes apathy and depression and anxiety, we need that success, because that success, what does it do, right? It releases dopamine. It releases BDNF for us to start making some of those brain changes. So that's what we need. We're going to release some dopamine by helping people make really small steps of success with an exercise program. This is how we get started in exercise for mental health. And Brian says, yep, it gave me confidence. Exactly. When you see that you're able to do it and then you start doing it regularly, your confidence builds. And that too releases dopamine. And that really directly leads into some of those changes that are going to occur in your brain and will actually start to change your anxiety, improve your depression, and direct effect on your mental health. So that's what I wanted to share today. Not just that exercise can improve mental health, but how to get started. How we as PTs, as OTs, can really help coach a person to get started in an exercise program for their mental health. Now, I am very thankful that I get to work on a team with psychologists and OTs and PTs and personal trainers to be able to do this. This is when somebody has depression and anxiety, this isn't something that we do alone. It's a team effort. And I'm really thankful to have that. If you are working with somebody and this is really hard, like, don't do it alone as a PT or OT. Have a team. I really benefit from having that team approach, and I know the people that I work with neurologic disorders do as well. So thanks so much for joining me today, and catch me on Friday. By the way, we've been really interested in autonomic regulation and biofeedback with heart rate variability. We've been trying out this cool new device this week, and so we're going to do a Facebook Live to demonstrate it and show you all about it. So join me on our Facebook page on Friday, and have a great week.